time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireable. When this joint drop, that is called the truth. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got the
Welcome to another episode of Kidney Hub East Africa. I am your host, Steve, the Kidney Nurse. Today, we have a special topic we're going to talk about that impact many people, not just kidney warriors in East Africa, but many people across the United States and abroad. So again, welcome. The topic is mental health and kidney failure. And today, as always, joining me all the way from Kisumu, Kenya, is Brother Moses, also known as the Kidney Ambassador. Let's bring the brother on with a warm welcome. Brother Moses, how you doing?
I'm fine, Brother Steve.
Can you hear me well?
Yes.
Welcome. And it's good to see you. I know you told me that you recently got discharged from the hospital. Can you share your experience about that?
Oh, yes. I had infection. And then I was it was discovered immediately after treatment, and therefore I was just referred straight away for admission. Then I was given a letter, and then I had to go and look for a facility of my choice, a facility that I can afford, and a facility that I can access. So I went to a government hospital. Then I was admitted. and discharged after 3 days. And now I am back, free from infection, but then ailing from other problems that arise here and there. But I want to say uh, the going is positive, and we just want to be a source of inspiration. This is why we prepare for this broadcast, and I am glad that I'm able to make it today. Thank you so much, Brother Steve.
Brother Moses, thank you for sharing that. I appreciate you coming on today. I'm sure you're probably not feeling 100%, but your dedication to the cause and being here in spite of how you may be feeling right now is greatly appreciated. Um, Brother Moses, as you know, the topic today that we're talking about is mental health and kidney failure in East Africa. Even though we know mental health impacts not just people in East Africa, but people who are dealing with this disease all over the world. But we know that our brothers and sisters, as you mentioned at times, some lack the information and education that help them navigate through this disease process. And we know that in East Africa faces high medical burdens plus big mental health challenges. We're talking about challenges like depression, anxiety, grief, sleep problems, and social isolation, they say are common and make medical care harder. Brother Moses, when you were hospitalized, did you experience any anxiety or depression while you were there, or any type of emotional challenge or feelings that were to you abnormal because of your admission for the infection?
Yes, Brother Steve, I'm one man who is really well organized. So whenever I get admitted, I really get depressed so much to the extent that um, I just do not know how to express it, but I really get depressed. I get irritated from just A to Z. I mean, your bed stays long without spreading. Sometimes you get the worst bed linen, and even the manner in which food is served. Um, Within this, our public hospital, we have ailing public hospitals. And most of us, that is where we warriors like myself can really try and access. So it is true that mental health as a warrior, you really have to work on it, because if you don't do so, or if you are not aware of it, then you might fall into serious consequences of mental health. And Brother Steve, these things comes at a time when you don't expect them. You just fall stressed, and then trying to cope up with a new environment, and sometimes nobody come and visits you, you know.
Mm.
And sometimes most people, and even your immediate caregivers that your immediate uh, 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 support system get tired on the way, and now you are left only they hope that you are doing fine. And it becomes so challenging, brother Steve, to the extent that even if you want to make a phone call just to say hi, or rather how you just want to check on extended family relatives, it really becomes a problem. Nobody receives your phone call. So it is true, mental health must be identified, brother Steve.
Wow.
Yeah.
Mm, mm, mm. So, Brother Moses, they say poverty, limited access to dialysis transplant, long travel for care, stigma, and lack of mental health services all increase psychological distress. Then it says addressing mental health is essential to improve quality of life, treatment adherence, and outcome. Now, do you agree that poverty, limited access to dialysis, transplant, long travel for care, stigma, and lack of mental health service increases psychological distress by you being a kidney warrior?
Absolutely. Absolutely true. In the sense that, in that order, maybe I would put it this way: poverty tops on that list because dialysis industry is still young uh, in Kenya and her neighbors, and you realize that the package, the government package that is a warrior benefits from, is so limited, and in most cases, I would say it's as good as just going for 2 sessions in a week and going back home, and then having lab works every month. Basically, that is it. But then what arises sometimes becomes a challenge. Everything that arises beyond and above that needs out of pocket uh, management, and therefore poverty tops on that list. Uh, and it costs so many things, like it makes uh, warriors unable to just get as minimum as irreducible need, transport to and fro. So it really becomes a big challenge, because in the first place, if you cannot reach to your facility and get treatment, then what of others, like food, um, uh, um, uh, further investigations that you are ordered to do, medications you need to buy along thing that is required, and so forth. And the list is endless, brother Steve. So yes, I do agree with you.
Brother Moses, let me ask you something. In your opinion, I know there's kidney organizations over in Kenya. do they help patients get transportation to and from treatment? Is there any such assistance available?
No, we don't have such systems available. Not even NGOs, we don't have. In fact, even for the disabled persons with disability, there's nothing like benefit one gets. Personally, I've been listed as disabled. I got my certificate 2022, and I've never benefited in anything for disability. So such organizations, yes, they do exist, but they are more of a briefcase of organizations. Yeah.
They don't.
So
They don't.
there's no support for warriors anywhere other than what the government provides. The
No
mega support
financial
that
assistance.
no financial assistance. Yeah.
So, how do most people get the treatment?
Uh, they can beg. Let me use that language. They can maybe depend on their social. For those who with a good support system, they depend on them. Uh, and maybe well wishers once a while. And that is how they make it. Days that they don't have, uh, you just don't, you will definitely miss it because nobody will care that you don't have the means to get to your treatment. Nobody cares. It becomes nobody's business, brother Steve. So that is
Wow,
how tough.
that's kind of hard to digest to hear that. Because I know here in the United States, you have a system called Medicare and Medicaid that often pays for a lot of services um, to get the patient back and forth. And some states may be different than others, but you got Uber, Lyft. These are all private transportation services that work by app. And then you have state provides transportation. You may have the main transportation, and they may contract out to third party transportation to pick up patients and take them to dialysis. Um, but I understand in your country, it's a lot different. And let me ask you this. What do you think could uh, work if there was an organization that helped patients? I mean, do you think that can work, or do you think the system would be overburdened because of the many patients that may fall in the category of poverty and getting the treatment? Would the system be overwhelmed,
Um,
in your opinion?
I wouldn't say y- y- yes or no because it would depend with the size and the magnitude of funding that is within and resources that is within uh, such an organization. Oh, I'm saying so because there are about 4.5 million uh, CKD patient in Kenya, and about 20,000 doing dialysis. So, yes, one organization with proper organization and proper funding and good resources management would enable uh, uh, everyone that needs support, get it. This means um, such an organization must now do household assessment and establish the most needy patient. Not everybody should benefit in that kind of scheme, but then uh, there need to be a mechanism of identifying this patient at their household level, so that you get to see who is needy and who is not needy. Then that one makes it possible to reach out anybody who needs it. Because say if 20,000 are on dialysis and maybe 5,000 are able to keep themselves, I think managing 15,000, say rotationally, or you ratio, you support, you know, uh, not fully, but you give like a side support, then it it is able to achieve its goal completely. So yes, it I do believe to the greater extent it can never be overwhelmed.
Mm-hmm. Mm-hmm.
Mhm.
All right, Brother Moses, let's look at some key points to explain to brothers and sisters that may be watching from East Africa and their families that may be dealing with kidney failure or kidney disease. One key point, that mental and physical health are linked. Mental and physical health are linked. Feeling depressed or anxious makes it harder to manage medicines, your diet, fluids, and clinic visits. And what can help is improving mood, improving the mood. So that may mean maybe some medical care or prescription. I don't know, Brother Moses. Let's talk about that. What do you think? Mental and physical health are linked. Feeling depressed or anxious makes it harder to manage medicines, diet, fluid, and clinic visits. Have you experienced that? And if you have, what have you done to improve your mood?
Well, uh, one thing as a warrior, you must know that even if your mental health doesn't affect you physically, but the fact that you are a CKD patient, you are definitely uh, uh, you are definitely to suffer and to experience some physical changes. Um, for example, you will realize that most of your outfit no longer fits you so well. So time and again, you get back to the repair tailor for some repair work, or you buy new clothes time and again. or you realize, like my case, I had several pair of shoes. I can no longer use them because they are heavy. So yes, um, that is expected, because they say you are what you think and you are
Mm,
what you eat. It is true that if if your heart feels not contented with the new norm, then definitely it shall be reflected on you physically. Uh, because depression just shows on your face. Things like stress just shows uh, on your face. Uh, how you carry out yourself, how you interact with others, just shows in your face, and that one means everything has been transformed from mental to physical. And now the best way, Brother Steve, you ask me how I've cope up with that, which is something I learn every day. I also search knowledge about it every day or anytime. What has always worked for me is just to try and to call it one day at a time. Sometimes you do not know what to eat today, but you strive to live for tomorrow. You don't have a bus fare to go to your clinic, uh, then you just live by it. You accept, because sometimes there are things you have control over, and some at times you don't have control over. So one day at a time is my mantra, and therefore these are always been my encouragement, that don't think about tomorrow, for tomorrow shall take care of itself.
mm,
Yes. So because brother Steve, let me tell you for sure, uh, how much you think about it, it will not change the situation. It will not change the situation. So yeah, you should be accepting each challenges each day and just move on, hoping that tomorrow shall be a better day. Let Because I've said to myself that even when CKD or or when the worst come, it should find me always on the move, not lying on the bed that I've lost the fight. No.
mm.
You understand, Brother Steve, what I mean?
Oh, absolutely.
Yes. So
Absolutely.
I think that is um, that is just one of the strategy of surviving, because after all, uh, nothing should scare you. Accept your condition, because all of us is headed into just that direction. Yes.
All
So
right.
that is how I've been coping it. And I want to encourage others not to worry about tomorrow.
Awesome. Thank you for sharing that, Brother Moses. Let's look at another key point to explain to patients and families. Distress is normal and treatable. Again, distress is normal and treatable. You are not weak for feeling this way. Because over in East Africa, they may have some type of stigma. If you got any type of illness, you may be considered weak. I don't know, Brother Moses can probably address that. But seeking help is a strength. Again, the stress is normal and treatable. You are not weak if you seek out help or feeling this way. Seeking help is considered a strength. And one more thing, key point, tell your kidney team or community health worker about mood changes, hopelessness, problem sleeping, appetite changes, difficulty concentrating, or thoughts of hurting yourself. Now, Brother Moses, do you want to address any of that, far as the stress is normal and treatable, and that how that's not considered weak, feeling that way, and actually seeking help is a strength? And um, another question to ask you, is it, what's the word? Is it worth uh, reaching out to the kidney team, letting them know if you got mood changes like hopelessness, problem sleeping, appetite changes, or difficulty concentrating, or thoughts of hurting yourself? Is it worth reaching out to the kidney doctor and the team, letting them know where they actually do anything? And
Well,
is there any insurance that will help? I'll let you speak.
yes, well, um, it is worth reaching out to care team. However, uh, uh, when you seek an appointment with the doctor, then yes, you can be heard and listened to. But away from our nephrologist who really understands patients, and most patients are attached to them, the only problem lies if you want to reach out to our nurses, because for one, other facilities do not have uh, well qualified nurses, and therefore, uh, one, they do not have the knowledge to impact on you, and two, they don't have the time. Then number three, they are not motivated to to also play an advocacy role to patient. So it really becomes a challenge if you really rely on the nurses and the tech team, because theirs is to come, um, make sure a day is gone, and count on days after day, so that at the end month they are able to take something home. So that is the spirit. But then there are there are very few, I think very few that the care team are so nice. At least they can share with the patient. You can inquire from them, and you can be answered accordingly. But then majority of our clinics, you realize that it's only doctors who are able to take time on appointment and explain to you all your answers and questions. But then it doesn't apply to the one who sees you on a daily basis. He or she doesn't have time to tell you anything. Even if you ask, they they will fall either into three: they do not know, they don't have time, or they are not motivated, brother Steve. So yes, That is the situation. Back to you. Sorry, I can't hear you.
I'm sorry, I had my mic on mute. I said,
Okay.
wow. So education is really key to, it seemed like, surviving if you have kidney disease or kidney failure, and learning all you can about your treatment and health, because uh, almost the way you make it sound like some of these providers don't know what they're doing.
Absolutely. Absolutely. Yes. There are some, what they are, I don't know how you call it, learning through a pretense. Uh, is
Or
it
like on the job training.
on the job training? Yes. So you see, uh, one thing I've noticed about on the job training is that one knows the routine of performing dialysis, but not knowing uh, the scientific reasoning behind every step. I want to give you a very good example. Um, in terms of hand hygiene, one can have mask on, but in between the procedure, the gloves doesn't remain sterilized. So you would see habits like one is on a sterilized gloves, and then at the same time he wants to pick a phone out of his pocket to receive. I think that is a damn very serious protocol breach, especially during the procedure. I don't know what you say about it.
Oh, absolutely. If you're doing a procedure, I know here in the United States, you're not supposed to answer a phone call while you're putting a patient on dialysis. That's a no-no. But you got some people do it, they may have their earpiece in. But to take your phone out in the middle of the floor doing put on and put it up to your ear, no, that is absolute no-no. So I know over in Kenya, East Africa, the laws and the rules may be different on, you know, how they punish their workers, and if they do punish them, because maybe it may be a shortage of workers there and they can't afford to fire anyone that's working on staff. So let's look at some practical tips, Brother Moses, for people with kidney failure. Some day-to-day practical tips that anyone that's dealing with kidney failure can use. One, keep a simple daily routine, regular wake ups, sleep time, small achievable tasks, and set times for medicines and fluids. Routines reduce stress and improve sleep. Do you agree with that, Brother Moses? By you being a kidney warrior, that if you keep a simple daily routine like a regular wake up or sleep time, maybe small achievable tasks like getting something done during the day, and setting time to take your medicine and fluids, do you think these routines reduce stress and improve sleep, in your opinion?
What has really worked for me is that actually routine makes me get tired so much, to be honest. Like going to sleep at this specific time or waking up specific time. I don't have time, specific time. But then when I have, say, an appointment with the doctor the next day and I'm needed by 8, I'll wake up appropriately. I'll have my alarm on, or when I'm doing other errands that I need to wake up at this particular time to begin prepare that one. For that reason, I will have to schedule a routine for that particular program. However, on a daily basis, I always just I struggle to live normal, though with caution. For example, caution with dietary, less sodium. Uh, I also regulate the amount of water I take, because there is always 500 milliliter bottled water with me in my bag. So I just drink, take a sip. And when I take maybe porridge in between, I will take just small amount. Or if there is tea, very small amount. So at the end of the day, I realize I've not even exceeded any fluid. Yeah. So myself, it has worked in a manner that I just try to live normally, but with limitation of certain things, Brother Steve.
All right. Thank you for that, Brother Moses. Let's move on to the next practical tip. Stay active within limits. Stay active within limits. Now we're talking about walking, household chores, and gentle exercise help mood and strength. Start small and increase gradually. What do you think about that, Brother Moses? Staying
Absolutely.
active and
Quite
within limits.
practical.
You agree with that?
Yes, it is quite practical. I walk. I walk up to the point that I cannot walk. Then I take rest to a nearby shade. I do walk.
Okay.
I do my house chores. Um, I can maybe begin with washing 2 or 3 of my shirts. Maybe tomorrow, one trouser. I mean, uh, it is not kind of Olympic practice, but then you just make it daily routine. Yeah.
All right. I think maybe you told me you did this, but this is another tip. Maintain social contact. Um, meet family, friends, or neighbors. Join or start a patient support group at the clinic, church, mosque, or community center. Peer support reduces isolation. Brother Moses, didn't you at one time uh, had or started a support group at your facility?
Yes, I've tried so many times. Uh, it doesn't work in the sense that most warriors here, they are in a state of hopelessness, and there is a culture that when you start a project like that, then you must be having money somewhere. So people just think there money somewhere that is available, that people are given to form such things. So they still do not understand the essence of forming these groups, because just sharing your problem or you get to hear somebody with a similar problem, then it gives you more impotence to, to live for the future. But then the barrier is that people tend to peg such organization with financial benefit, or that maybe whoever who created this must be benefiting from this, and us, we are not benefiting. So it is really a bad culture that we have here in Kenya, that also makes it a big barrier for such organization to flourish, Brother Steve.
And that's unfortunate. That's
Yeah.
very unfortunate.
Yeah.
Let's look at another practical tip. Um, Using simple coping tools. We talking about like pace breathing, short relaxation breaks, listening to music, prayer or meditation, keeping a short gratitude or symptom diary. What do you think about that, Brother Moses?
Oh yes. Oh yes. Um, for one, music does well for me, because I enjoy music, especially from my countrymen. Um, there are some rhythms that are soothing. You get to listen to them. You don't need to get to the dancing floor, but it can soothe your heart. Yeah, yeah. So these things, they work, Brother Steve. It's only that we are not aware. Most of us are not aware that they do work.
How would you think it would? Uh, how would we? Could you let people know in Kenya that's dealing with uh, maybe some type of anxiety or depression, uh, to get this information if it can't get it from the unit or the clinic?
Um, it
In your
is, it
opinion.
is, yes. Um, because you did mention earlier, for such an organization, uh, maybe of supporting patient, not financially, but this organization makes things like the physical event organization, reaching out to churches, worship places, and then you get real in touch with the community, then it can make some impact. Because uh, when you make it online, sometimes people go search for, uh, people just go to search engine to get comedy. And the moment you make it practical, you remember, Brother Steve, how HIV uh, awareness was there before, or you make it like a real thing, malaria campaign. Yeah, I don't know whether you have an idea how it's done in Africa. That physical outreach, then it can really reach to several population. But that one also comes with a very well organized organization, just that just work on how to reach those community via those places I've mentioned, Brother Steve. So reaching them physically, schools, gathering, uh, uh, There is something called baraza. It is a traditional gatherings. Yes. So it can work in that way. Yeah.
Okay.
Yeah.
Um, let's look at another practical tip. Sleep hygiene. Limit naps. Keep bed for sleep. Avoid heavy meals, caffeine before bedtime, and have a calm pre-sleep routine. Brother Moses, do you have a sleep routine?
No, actually, I have a serious sleep problem. I don't have a routine. I don't. What I try to avoid is naps in between the day. But then sometimes I get overwhelmed because of exhaustion. I find myself sometimes I just take a nap for maybe 10 minutes. But then during the night, I get, I, I have a big problem falling asleep. I was prescribed some medication, but then I get sedated so much during the day, and it makes my body so much heavy. So I don't like it at times. Yeah.
Okay. Um, Another tip, nutrition and fluids. It's suggested that one follow clinic advice on salt, fluids, potassium, and phosphate control. Good symptom control reduces anxiety and shortness of breath, which I'm sure you could possibly agree with, Brother Moses, because we know when it comes to um, intake, a high intake in sodium, that increase fluid intake. And then you got high phosphorus. You got to think about uh, high potassium, which can trigger a cardiac arrest. And then you got high phosphorus, which over the long term can cause bone problems and itching in the short term. So it's definitely to control that. And if you got a lot of fluid on, it can also contribute to shortness of breath, which can also contribute to anxiety because you may feel like you can't breathe. Brother Moses, anything you want to comment on?
I know the list is so long, but then uh, 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 these are things just await any patient, something like shortness of breath because of maybe cardiovascular issues. Um, I've had some development with myself um, about it, and that led me to be given a disability certificate. Uh, it is called bone mineral disorder. That I know majority of warriors really experience this. Some cannot walk completely, not even with a support of a cane. Um, it it really affects most of warriors, something like bone issue. So yes, I do agree. Yeah.
No. Also, another tip, avoid alcohol tobacco, and non-prescribed medicine, including many traditional herbs, without first checking with your clinician. This stuff can worsen kidneys or interact with treatment. Another thing, avoid, I'm sorry, plan transport and finances for clinics. Ask social workers, NGOs, or hospital departments about subsidized payment plans or charity funds uh, before costs become an emergency. Now, Brother Moses, you want to comment on both of those two about avoiding tobacco, alcohol, and non-prescribed medicines, including traditional herbs, and about planning for transport and finances for clinics. And is there any such way that one can talk with the social worker, NGO, or a hospital department about subsidies or payment plans or charity funds early before this cost become overwhelming? I want to let you answer these two while I go take care of something right quick, okay?
Okay.
All right, take it away.
Okay. Well, um, what happens is that whatever the support one gets is purely based on family support, friends, and well wishers. So I'd mentioned earlier that we don't have NGOs here that supports that supports uh, CKD patient financially, and then it means one has to work out his or her ways of financing bus fare to and fro. And such organization, even if they are there, it means uh, uh, the next thing they can provide is maybe to create awareness and nothing beyond that. But then I know of other things that patient can do because nobody cares when, where, and how you will get the bus fare. So they don't talk about something like that here. The best you can do is to reschedule your appointment. If you are to come morning hours, you can request for afternoon hours. That is the match. Or if there is a medical camp, maybe that would come once a year or twice a year for various specialities. For example, in Kenya, we do have fistula camp, whereby if you have to be fixed fistula, then the government pays for it for free. So it is something that comes yearly or twice a year. And if beyond camp and reschedule, I don't see anywhere else that this patient gets support, Brother Steve. But then alcohol is definitely a no-go zone because alcohol is quite much addictive, and the best is just to avoid it. Why? Because it is addictive. It is a drug that makes us get addicted. So such scenarios, what is just a no-go zone should remain a no-go zone, Brother Steve. Yes.
Well, thank you for that, Brother Moses. I appreciate that. Um, I just hope that this broadcast can get out to kidney warriors in East Africa uh, by way of, if they're not on now, by rebroadcast, by going to my YouTube page, Steve the Kidney Nurse, or the FIGO Initiative page that Brother Moses runs on Facebook, or Steve the Kidney Nurse Facebook page, because I believe many brothers and sisters that's dealing with kidney failure, kidney disease in East Africa um, should be getting education to help them navigate through this illness in a proper way that can also address the mental health issues that go behind it. Now, let's look at, as the literature says, and Brother Moses, you can verify this, low cost mental health supports that work. One, peer support groups, clinic based or community, and family involvement are very effective and low cost. Brother Moses, your time being on dialysis in Kenya and the different treatment clinics you have been to, have you seen any clinic based support groups or any support groups in the community that supports kidney disease or kidney failure?
Well, w- we have, as a patient, we tried to create a universal uh, support group that so that all warriors in Kenya can engage on that platform. But then some ended up not understanding the purpose of forming that group. Others ended up sharing what is non kidney related material on that. And then others thought that this is an opportunity to, to seek financial support in that group. And it became so tricky because, look, for example, if somebody is asking for financial support in such a group, and everyone there is sick, should be asking it means everyone should be asking financial support on that platform. Is it really realistic? So on the way, others felt out, others never saw the meaning of forming that group, and it was really not easy to administer uh, uh, that social platform. I don't want to
Yeah,
give by name, but
I understand.
but
I
then
believe such groups such as
yeah,
that,
but
you got,
then
no, only I was going to say,
sorry.
I believe in such groups such as that, you got to set out in the beginning that no form of asking for financial support would be um, admitted?
Actually, those were one of the rules. Um, but you realize some started asking, few also gave out, thinking that when they have problem, they are also insured. They might get, that kind of funny stuff. So um, nobody was following the rules, and even up to date, uh, uh, the rules are not being followed. So that is why each time you ask me about reaching out to warriors, I see a scenario whereby there is a caravan moving around. Maybe on the caravan we have uh, Kidney Hub East Africa that will be moving around, and then having projection teachings, and having volunteers to give speeches, you know, on churches, and even renal nurses maybe volunteering to teach particular subject in such organization, and then you top it up by social media, then everything just go fine. Uh, uh, but without caring, without caring uh, about, I mean, putting it clear that this organization does not support any financial material. This organization does just purposely to reach out to people so that everyone to get the information right there, because we have information out there that are not authentic. People consume this and that, brother Steve. So that is what I can add on. Yeah.
Okay. Okay. Um, Another low cost mental health support that they say that works is problem solving therapy and brief counseling delivered by trained nurses or community health workers. Task shifting can reduce depression and is feasible in low resource settings. Now, Brother Moses, again, you're right there in ground zero. Have you seen any trained nurses or community health workers that come into the clinics or into the renal dialysis community to uh, talk about mental health or give any type of problem solving therapy to help with whatever they may be dealing with mentally?
Um, 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 uh, not, not at the primary care units we have in the country. The model system of government of treatment in Kenya is that you begin from primary health care, then you are referred up to the national hospital. Now, these small units do not have those cadre of professionals. However, if you move up higher at national, like Kenyatta National Hospital, we have nurses over there that are counselors, and they take care of such like mental issues, mental health. I mean, and besides that, there are very few anyway. There are very few, or if they are available, they are always on appointment, and that is private arrangement. But few that are available at Kenyatta National Hospital are also overwhelmed in a way because there are referrals all over the country. So at village level, even where I am, and all those places I've been, I've never seen someone talk about mental health. I've never seen, unless unless you are informed, you are advised, or you had a discussion with your nephrologist, then he can advise you where to get one at your own cost. Yes.
Wow. All right. Let's look at group activities that can be a low cost for mental health support. Group activities such as exercise groups, income generating cooperatives, prayer groups. These type of groups provide structure, purpose, and social contact. Brother Moses, I know you had mentioned one time or another that you go to church or participate in church groups. Are there any type of groups you've seen over in Kenya um, dealing with kidney disease, like exercise groups, maybe diet groups, um, um, people banding together to generate uh, income, uh, prayer groups? Have you witnessed or seen that in Kenya?
I've seen a physical training group uh, just for healthy people, but those on dialysis, it is something I think it is even unimaginable because remember, most warriors are in that state of hopelessness, and telling them to do exercise, it's like that exercise won't help them. Already they have given up that maybe the next moment he will not be there. So that is the reality. And it is something they cannot imagine because of that state of hopelessness, Brother Steve. But in churches, um, there are category, like in my church, um, there is a special department that also deals with the sick, and they might be comforted and prayed for, and maybe talked to, just in general, not uh, tailor-made to suit every individual. So it really becomes a challenge to have
Mm.
such. Yeah.
Yeah, I'm sure getting people to come out and support the group is a big challenge as well. You're talking about if they don't have um, transportation, the location of the support group, a means of getting there, getting back home. Um, that's why maybe having a online group through means like this where I'm sure that most Kenyans have access to the internet, um, YouTube, something basic, um, Facebook, to where they can see a professional advocate and a kidney warrior and an advocate discussing problems that they may be going through at this minute. And maybe some of these tips can help in spite if they can't get to um, professional treatment. Now, it's also suggested, if available, short courses of psychotherapy to include cognitive behavioral or problem solving and antidepressant medication under a doctor's supervision can help. Tell clinicians about kidney function so dosing can be adjusted. That's if you want to go the medicinal route in treating depression or anxiety. Now, here go some tips for caregivers and family. Listen, anybody dealing with kidney disease that's a caregiver or family member of someone dealing with kidney failure, don't matter if you're in East Africa or not, can benefit from these tips right here. Listen without judgment. Ask how the person is coping and encourage small daily goals. Help with medicines, counting fluids, attending clinics, and watching for danger signs, breathlessness, swelling, confusion. Encourage participation in support groups and social activities. Caregivers also need breaks and support. Seek help from extended family or community volunteers. Brother Moses, anything you want to add into the tips for caregivers and family that I just went over?
Oh yes, caregivers must also understand that. I mean, yes, the caregivers must also understand that uh, some of the mental challenges patients are facing. Uh, Patients themselves are not in a position to recognize them. So you just have to bear whatever development that happens uh, to your loved one who is going through this. Yes.
Mm-hmm. What about support groups over there? Do you think over in Kenya and East Africa, in your opinion, you think there's enough support groups?
There are so many support groups, but people do not buy the idea of having that support group. So even if there are so many here right now, but people do not buy the idea that this support group can really help so much. Some view it with a lot of suspicion. Others also, just like I'd mentioned earlier, are in a state of hopelessness. They don't see anything that support group can help them. So these and many more challenges makes that barrier for the support group to help efficiently. Yes.
Okay. Okay. Now, this next one I know is big in East Africa. Traditional healers and faith leaders. They say working with traditional healers and faith leaders, engage respected community and faith leaders as partners. They can provide psychosocial support and encourage medical care. Also, it says encourage patients to tell their clinician about any traditional remedies being used so risk can be assessed and interaction avoided. Uh, do you see many people going to traditional healers and faith leaders to deal with uh, mental illness symptoms such as anxiety or depression, Brother Moses?
Oh, yes. My opinion is the traditional healers and even the spiritual leaders, stroke healers. These are another brand of people that might really contribute towards the betterment of warriors here in Africa as a whole, because everything shall be spiritualized. What do I mean by that? Instead of telling the patient that dialysis is very important or this kind of treatment is very important, these healers would want to portray a picture that God heals, that He will pray over it, and a miracle shall happen, and everything shall be sorted. You know, this one now defies all the efforts that have been made. That is for the spiritual leaders and the men of the collar. However, on the other hand, uh, the traditional healers, the herbalists, they are the most unscrupulous businessmen, because this is where, Brother Steve, you would find brands of herbal tea, uh, the magic pill that cures everything under the sun and below the sea. So they will really market this thing aggressively to capitalize on how these warriors are desperate. So you realize you want to give more to the church without an objection. Uh, uh, you are yearning for miracles. On the other hand, for the herbalist, they are promising you just instant solution. So these are group of people that must be dealt with a lot of cautiousness, Brother Steve.
I agree with you 100% because I'm sure they're swindling a lot of people out of hard-earned money. Um, Brother Moses, let's talk about when patients should seek urgent help, mental or physical. Now, mental health emergencies, clear plans or thoughts about self-harm. This is an emergency. You know, somebody got a clear plan or thoughts about self-harm, saying stuff like goodbye, giving away possessions, or severe inability to function, should seek urgent medical help. Medical emergencies consist of symptoms like severe shortness of breath, chest pain, very low urine output, severe vomiting, high fever, sudden confusion, or extreme weakness, you should go to the nearest hospital if you're experiencing that. Um, Brother Moses, anything you want to add before I move on? Or when to seek emergency help, whether it's mental or physical?
I think just in a nutshell, um, if you see any changes, any abnormality, then you should quickly rush to and inform the care team.
Um,
Yes.
all right. Um, Brother Moses, have you ever been at home and had to seek emergency care
Yes,
from
severally.
home?
Yes, severally. Um, just matters of infection I've dealt with on so many occasions.
Mm-hmm.
Uh, However, my current facility, I've only had infection twice. They are better off than where I was before. Uh, I've been rushed, sometimes just rushed for something like malaria. Uh, so it is an experience that I've gone through. Yeah, from home, you are rushed to hospital.
Okay. Okay. Thanks for sharing that. Um, Now we're definitely way over time, about 30 minutes. But let's wrap it up by, if you're watching this, and Brother Moses, you could probably implement this as well. But if anyone else, East Africa, uh, watch this broadcast and you want to advocate or bring awareness to your community pertaining to kidney disease awareness, uh, you can start uh, by trying to integrate screening for depression, anxiety into kidney clinics, simple screening questions or short tools. Train nurses and community health workers to provide basic psychosocial counseling and referral. Promote home based, if you can do it in East Africa, peritoneal dialysis where feasible, and better transport financial support to reduce travel related stress. Also, support patient associations and community fundraising to reduce out of pocket costs and stigma. Um, and that's basically it. Uh, Also, you want to try to get involved in uh, support groups. Uh, Look out after the kidney organizations that Brother Moses may have mentioned, to see if they have any legitimate support groups running, or if there's any hospital-based support groups, and see where one can get trained to become a community outreach worker for kidney health and promotion. Brother Moses, this has been a great show. Do you have any last words you want to say before we end the broadcast?
Oh yes. I want to say that I want to encourage uh, every warrior out there just to advocate for yourself. Very important, and at the same time advocate for others. So that is the best move forward. Yeah.
Brother Moses, I definitely agree with you. And I will hope as we continue this broadcast each week that more people will come out and support the broadcast and watch, share, and interact. Because that's the only way we're going to get this education out there for the thousands, and I mean thousands of people who deal with this disease on a daily basis. Brother Moses, this has been a great show. Wishing you safe treatment this Tuesday and have a great week. Glad to see you out of the hospital and that you're recovering slowly, and wishing you a speedy recovery. Anything else you want to say before we tune off?
Okay. Thank you so much for making it up, Brother Steve. I know you are having a busy schedule, and sometimes you're also overwhelmed with work and responsibility, but you still make it to sacrifice for this show, Brother Steve. I want to say, may God bless you so much for the sacrifice you are offering, your expertise to run, to enable this program to happen every day, every Sunday. This is the show to watch, Kidney Hub East Africa. I'm also grateful for everyone who is giving us support by tuning in. Thank you so much, and God bless you all.
Thank you, Brother Moses. God bless you. God bless the audience. Thank you all for watching another episode of Kidney Hub East Africa. We'll see you next week, same time, same channel.
Same.
Yes, and have a great week, everyone. God bless.
God bless you.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.